Today we are going to talk about something that might feel a little uncomfortable, but it's incredibly important for all of us, especially as we get a little older. We're going to delve into a topic that touches on one of our most vulnerable states, sleep. You know that time when we're supposed to be resting, recharging, completely safe and sound. But sometimes, for some people, sleep can unfortunately become a time of unexpected danger. We're talking about the unsettling reality of why people sometimes die in their sleep. Now, I know that sounds alarming, and honestly, it is a little bit. But the goal here isn't to scare you unnecessarily. It's about bringing these possibilities out of the shadows, understanding why they happen, and most importantly, what we can potentially do to protect ourselves and our loved ones. Because knowledge, as they say, is power. And when it comes to our health, that couldn't be more true. We often think of sleep as this peaceful, automatic process. You lie down and close your eyes and your body just takes over, right? Well, yes, but it's also a complex period for our bodies. Our heart rate slows, our breathing changes, our muscles relax, and our brain cycles through different stages. For most of us, every night, this happens without a hitch, but for some, underlying health issues, which might be manageable or even silent during the day, can become critical when the body is in this altered state of rest. Think about it. During the day, you're up and about. If you feel a strange pain, shortness of breath, dizziness, or something just feels off, you're usually aware of it. You can sit down, take medication, call for help, or go to the doctor. But when you're asleep, that awareness is gone. Your body might be sending distress signals, but your conscious mind isn't there to receive them or act on them, and that's part of why sleep can be a vulnerable time. So, what are the main culprits? What are the conditions that can turn a seemingly peaceful night's sleep into something far more serious? The vast majority of cases involve problems with two of our most vital systems, the heart and the lungs. Let's start with the heart. Our cardiovascular system works tirelessly, pumping blood throughout our bodies every second of every day. But it's not immune to problems, and some of those problems can become particularly dangerous at night. One major issue, and one you've likely heard a lot about, is sleep apnea. Now, sleep apnea might sound like just a snoring problem, maybe annoying for your partner, but harmless, right? Absolutely not. Sleep apnea, particularly obstructive sleep apnea, OSA, is a serious medical condition. What happens is that during sleep, the muscles in your throat relax too much, and your airway becomes narrowed or completely blocked, as causes you to stop breathing, sometimes for 10, 20, even 30 seconds or longer, multiple times throughout the night. When your breathing stops, your brain realizes you're not getting oxygen, and it briefly wakes you up just enough to gasp for air and reopen your airway. You might not even remember waking up, but this cycle of stopping breathing and waking up is incredibly stressful on your body, especially your heart. Imagine holding your breath repeatedly throughout the night. Your oxygen levels plummet, and your heart has to work harder and harder to try and compensate. Over time, this puts tremendous strain on the cardiovascular system. Sleep apnea is strongly linked to high blood pressure, irregular heart rhythms like atrial fibrillation, heart failure, stroke, and yes, even sudden cardiac death. Why is it so dangerous during sleep? Because that's when it happens. You're not aware of the repeated drops in oxygen or the stress on your heart. These episodes can trigger a dangerous arrhythmia, a sudden, chaotic change in your heart's electrical activity that prevents it from pumping blood effectively. If this happens and isn't quickly corrected, it can be fatal, and because you're asleep, there's no chance to feel the warning signs, the sudden pounding heart, the dizziness, the chest pain, and get help. The autonomic nervous system, which controls involuntary functions like heart rate and breathing, behaves differently during sleep stages, sometimes making the heart more susceptible to rhythm disturbances triggered by low oxygen or the stress response from waking up. Beyond sleep apnea, other direct heart issues are major contributors. Silent heart attacks are a terrifying reality. We often picture a heart attack as someone clutching their chest in excruciating pain, and often that's true. But many heart attacks, especially in women, older adults, and people with diabetes, can have very subtle or even no symptoms at all. These are called silent heart attacks. You might feel a little fatigue, some mild discomfort that feels like indigestion, or shortness of breath that you dismiss as just being tired or getting older. If a silent heart attack happens during the day, you might eventually notice these subtle signs, or someone else might. If it happens during sleep, you're completely unaware while the damage is being done to your heart muscle. In some cases, a silent heart attack can trigger a fatal arrhythmia. The lack of conscious awareness during sleep means critical time is lost, time when emergency medical help could make a difference. Arrhythmias themselves are a significant risk factor. Conditions like atrial fibrillation, AFib, where the upper chambers of the heart beat irregularly and often rapidly, or more dangerous ventricular arrhythmias, where the lower chambers beat chaotically, can lead to sudden cardiac arrest. While arrhythmias can occur at any time, changes in the body's autonomic nervous system during sleep can sometimes trigger them or make them more likely to become life-threatening. For example, changes in vagal tone, part of the autonomic nervous system, during certain sleep stages can influence heart rhythm. Again, if a severe arrhythmia occurs during sleep, you won't feel the warning signs, and there's no opportunity to seek immediate medical help like calling 911. The heart can simply stop pumping effectively without any chance for an actionable response to save you or your loved one. Heart failure is another condition that can worsen at night. With heart failure, the heart isn't pumping blood as efficiently as it should. Lying flat can make it harder to breathe as fluid can back up into the lungs. This increased strain on an already weakened heart can sometimes lead to a crisis during sleep. People with heart failure may experience paroxysmal nocturnal dyspnea, waking up suddenly feeling breathless. This is a serious symptom and indicates the heart is struggling. If the heart's function deteriorates significantly overnight, it can lead to a fatal event. Now, let's move to the lungs and breathing. Our respiratory system is just as vital as the heart. Conditions that impair breathing can be incredibly dangerous, especially when we're asleep and our respiratory drive is naturally reduced. During sleep, our body's sensitivity to carbon dioxide, which normally prompts us to breathe, is decreased. Basically, we've already talked about sleep apnea, which is fundamentally a breathing problem that impacts the heart, but other lung conditions are also risky. Chronic obstructive pulmonary disease, or COPD, which includes emphysema and chronic bronchitis, makes it hard to get air in and out. People with severe COPD often have lower oxygen levels even when awake. During sleep, particularly during REM sleep, when breathing can become more shallow and irregular, oxygen levels can drop to dangerously low levels. This lack of oxygen, called hypoxemia, puts a huge strain on the heart and brain and can be fatal. The reduced respiratory drive during sleep means the body is less likely to compensate for already compromised lung function. Severe asthma attacks can also occur at night. Nocturnal asthma is common, and symptoms like wheezing, coughing, and shortness of breath can worsen during sleep. This might be due to changes in airway inflammation, hormone levels, or even cooling of the airways at night. While most people with asthma have rescue inhalers, a severe, sudden attack during sleep might leave someone unable to use their medication or call for help. They might wake up gasping, but be too impaired to act. It's not just the heart and lungs, though they are the most common culprits. Neurological events like strokes and seizures can also happen during sleep, and sometimes lead to death. A stroke occurs when blood flow to the brain is interrupted, either by a clot called ischemic stroke or bleeding known as a hemorrhagic stroke. Strokes can happen at any time, but some research suggests they might be more likely during sleep or shortly after waking. Like heart attacks, some strokes can be silent or have subtle symptoms that are missed. If a severe stroke occurs during sleep, the person is obviously unaware and unable to get the immediate medical attention that is critical for stroke treatment and survival. A stroke can impair the brain's ability to control vital functions like breathing and heart rate. A stroke affecting the brainstem, for example, can directly interfere with respiratory control. So given all this, what are the warning signs? This is where the slight alarm comes in, but it's paired with the crucial message of what to look for. Because while death in sleep can be sudden and unexpected, sometimes there are signs, often dismissed or attributed to something else. For sleep apnea, the signs that are often noticed by a partner include loud, disruptive snoring, episodes where they witness that breathing stops, gasping or choking sounds during sleep, and excessive daytime sleepiness despite getting enough sleep. The person with sleep apnea might wake up with a dry mouth, sore throat, or morning headaches. They might also experience difficulty concentrating, memory problems, or irritability. Also, pay attention if you fall asleep easily during the day when you don't intend to, like while sitting and reading or watching television. If your partner has noticed these things, or if you experience excessive daytime fatigue that impacts your life, do not ignore it. It is not just getting older or not sleeping well. It could be sleep apnea, and getting diagnosed and treated can be life-saving. For heart issues, warning signs might be subtle chest discomfort, shortness of breath, especially with exertion or when lying flat, palpitations or a feeling of the heart fluttering or racing, dizziness, unexplained fatigue, or swelling in the legs or ankles. These symptoms might be present during the day, but could worsen or become more dangerous at night. Pay attention to how you feel, even if the symptoms seem mild. Shortness of breath that wakes you up at night is a significant warning sign of potential heart failure. Unexplained fatigue that limits your usual activities should also be investigated. For lung conditions like COPD or asthma, worsening shortness of breath, increased coughing or wheezing, or increased mucus production could be warning signs that your condition is not well controlled and could pose a greater risk at night. If you're needing to use your rescue inhaler more often, or if your symptoms are interfering with your sleep, it's time to talk to your doctor. Neurological signs could include unexplained severe headaches, sudden weakness or numbness on one side of the body, difficulty speaking, or vision problems, even if temporary. While these are classic stroke signs that usually prompt immediate action, subtler or transient symptoms might be dismissed. For seizures, a history of epilepsy or unexplained episodes of altered consciousness or strange movements should always be discussed with a doctor. Any new neurological symptom, no matter how brief, warrants medical attention. The key takeaway here is vigilance. Active awareness of your body and any changes you notice. This includes involving your loved ones, encouraging them to speak up if they notice concerning signs during sleep like loud snoring or gasping, as their observations can be valuable. Don't dismiss symptoms, even if they seem minor or can be attributed to just getting older. Getting them checked out is always better than ignoring a potential warning sign of a life-threatening condition. You are not powerless in the face of these risks. The most important step you can take is talking to your doctor about your health, medical history, lifestyle, and any symptoms or sleep concerns. Get regular checkups. Manage chronic conditions diligently with prescribed treatments and lifestyle adjustments. Adopt a healthy lifestyle, including diet and exercise, and review your medications regularly to avoid dangerous interactions. By understanding the potential risks and taking these proactive steps, you significantly reduce your vulnerability and empower yourself to protect your health, ensuring sleep remains a time of peace and restoration. Thank you for watching. Subscribe to our channel for more senior health videos that you can trust.